What is the one thing that connects all us humans together? Most would say our emotion, some would say our knowledge, and a few would even say our behavioral tendencies. But I would argue that it's our health. I would argue that it's our biological and physiological need to survive on this planet. Now take a moment and imagine if that was taken away from you. If your identity, your health, who you are was compromised, simply because you grew up in a developing country, a place where the idea of a sustainable healthcare system was just that, an idea. To us, it's our greatest nightmare, but to so many people around the world, it's a reality of the present. Hi, my name is Ria, and recently I've been diving into this whole new world of applications when it comes to global health and virtual reality, and how we can not only look at these two different fields as something that's thriving right now, but how we can combine them together and completely revolutionize the way that we view doctor-to-patient communication online, innovating telemedicine, or even providing so many different people resources, a chance that we have access to on a daily basis. Living in Canada, I personally have access to so many different resources on a daily basis. If I get hurt or injured, I have an ambulance a phone call away, more hospital food than I can ever imagine, and so many doctors that are at my attention when I get to the hospital. But there's so many patients in developing countries that don't have access to those same resources, simply because of the place that they grew up in. This means that there's an increasing amount of problems with the demand to supply ratio of doctor versus patients in so many developing parts of the world. As the supply of patients is increasing, the actual amount of doctors is decreasing. According to a study done by the World Health Organization, over 45% of member states reported that they had less than one doctor per 1,000 patients. Less than one doctor per 1,000 patients. Compare that ratio to a country like Qatar, which is currently one of the world's most forward leaders when it comes to global health and innovative thinking in medicine, having an all-time high of about 8 doctors per 1,000 patients. Doesn't seem like much until you compare that to so many different people around the world and how their ratios are not increasing sustainability like Qatar or so many other countries like USA and Canada. This means that something needs to change. We all know that the amount of patients is not going to decrease anytime soon. I mean, there's so many different problems in our world, like environmental damage, climate change, pollution, that have caused so many different environmental-based diseases. That means that the amount of patients is actually going to increase over time. And that means that we also have to make sure that the amount of doctors is enough to sustain the growing population of patients. A couple months in last year, I started getting all these thoughts about wanting to help the world and change so many people's lives around it. So I joined the Hospital for Sick Children, a place where they're completely innovating the way that we view global health and getting at the forefront of helping so many kids, families, parents, adults worldwide that don't have access to the same resources that we do. This worldwide healthcare efficiency inspired me to join this hospital and participate in a lot of the projects that we're doing. I'm going to break some down for you today. But actually, let's break down the problems with what is already existing. Luckily, there are fields of medicine you can think of almost as doctor-to-patient communication online that are helping with this exact same reason for global health inefficiency. A new field of medicine called telemedicine has recently explored, where basically think doctor-to-patient communication, but through FaceTimes and remote visits online. This field of telemedicine is exactly what was needed to help the international medicine crisis, connecting doctors and patients from all parts of the world over one centralized platform to communicate, talk. Doctors can even consult and diagnose the patients and remote monitor them from developing countries. Sounds like the perfect solution, right? Well, in 2016, it was reported that a couple of researchers who want to investigate this idea of telemedicine decided to pose as patients and turned to 16 different telemedicine apps to diagnose their skin issues. The results? Some of the doctors misdiagnosed a condition for syphilis, a few of the doctors prescribed the unnecessary or wrong medication, and a couple of the doctors weren't even licensed to practice in the same state that the patient was living in. These are the type of regulations that telemedicine is using. Sick Kids also has a big telemedicine field, but we're figuring out a way to innovate the technology behind it. And I'll jump into that a little bit later. But I'm just jumping in to the surface level of the problems with telemedicine. There are so many different things that we have to start thinking about and start innovating when it comes to our future. Doctor-to-patient communication online is revolutionary. It's going to completely change the way that we view not only any technology, but also giving so many people the right to basic healthcare. But it's not enough. In an age where we're using biometrics for body language recognition or machine learning to predict sepsis, we can't keep relying on old forms of technology like FaceTimes and emails to get us through. That's what telemedicine is deployed through. We have to start thinking in a different way. We have to start thinking in a way that we can surround ourselves with technology and start thinking bigger and brighter. This is where we can invite virtual medicine and virtual hospitals into the picture. We all know that telemedicine has its issues. It's technologically limited, but that's not the secret. That's not the surprise. What is that our scope of thinking about these possibilities are even more limited. So, how can we now use technologies like virtual reality to completely change the game when it comes to simple things like remote visits or FaceTimes? Well, what if we were able to use things like virtual reality to completely change the game when it comes to telemedical models and allow doctors and patients from all over the world to connect over a platform? But instead of using things like FaceTimes or emails to do that, we use virtual reality. We harness the power of simply throwing on a headset, but envisioning an entirely different world. This is what virtual medicine offers. This is a little bit of what I've been developing with the Hospital for Sick Children. I work in a couple of labs. One of them being the Cardiac Research Institute lab. And a lot of what we focus on in there is basically monitoring these different diseases like pulmonary vein stenosis or cardiac diseases using techniques like 3D imaging. Now, having all this information about patient scans and 3D imaging, all these different types of patient data uploaded into a medical database allows us to keep track of the diagnosis and also allow us to have that early intervention factor in case the patient has a disease so we can treat them early on. A main focus or objective of our study right now is to basically have databases that we can store patient information in, but also these different 3D cardiac imaging data about how the heart looks like, their anatomy, all the different types of really cool things. But I started to wonder, why are we using only 2D data to do that? So I also decided to step a little bit into the augmented reality world and show a snippet of what I was able to do using augmented reality programming, and also how I was able to insert virtual elements of 3D models from basically 2D patient MRI scans. The really cool part about this is that AR is so easy and accessible to use or program that you can basically insert any elements virtually into our world. It was so awesome to play around with this and be able to implement models I built programmed into the augmented reality platform, which basically converts 3D models into either virtual reality or augmented reality demos. So here's a quick glance at what I was able to do. This is basically a basic augmented reality cardiac model. We can use things like augmented reality or 3D converter model while scanning over patients, and 2D MRI full body scans to basically show a projection of the 3D model. So to kind of demonstrate this vision of the future, I decided to create an actual virtual reality simulation. So this is a three-dimensional model of a virtual reality simulation that I created using the Autodesk and Google Poly software to kind of deploy how an actual setting of the surgical world would look like in the virtual hospital and what doctors would be able to see exploring the interface. So if a doctor sitting in Canada in a hospital were to throw on a VR headset and tune into a VR surgical simulation halfway across the world, this is kind of like what they would be seeing. You can also think of this as almost like characters in a video game and how they're able to interact with each other, listen to each other, and kind of make it feel like they're in an actual physical world. Oftentimes, to get better visualization measurements, a full body scan is usually needed virtually to show your presence and communicate your thoughts during the surgical simulation, or even if you're in the hospital in the virtual world communicating with other doctors, a full body scan is usually needed to actually show that you're virtually there. Even if you have patients taking 3D scans through MRIs or head CTs, you can even have all that information uploaded to the virtual hospital, basically making it a central medical database instead of having that information in 2D communicated through medical records. This will completely revolutionize the way that we view medical care and really having a 3D lens to view so many different patients and their diseases and their organs. But of course, none of this can happen without the proper tools, equipment decentralization, infrastructure, and partnerships taking place. We really want to create this vision of the future, but we have to actually start by developing this idea in the present and figuring out small steps that we can take towards building this virtual reality revolution in healthcare. So to do that, I'm currently working with Sickets International and a telemedicine and virtual reality team at the hospital to basically just understand what are the biggest problems with telemedicine. Is it patient connection? Is it not having visualization for doctors? What are these hardcore problems with telemedicine, and how can we use virtual reality to solve them? Our future is built on the intersection between technology. That's not a secret. the technology of the future, and the problems that we're experiencing right now in our present. From crazy things like neural networks, to predicting diseases, to climate change and nanotechnology to solve the issues with pollution. Anyway, thanks for watching. I could really go on and on about this for days. The applications of global health and virtual reality are truly amazing, and we'll really be able to see them down the line when we actually start to open our eyes up to the existing problems in the world, and the fact that there's so many that we need to use technology to be able to solve them.